evening. I'm Leyna Cotran. This is Arab TV. I'm filling in for Suadas for this evening. With me tonight is Dr. Theo Nicolaides from the University of California, San Francisco. Dr. Theo Nicolaides is a children cancer doctor working at the University of California, San Francisco, Benioff Children's Hospital. In addition to taking care of children with cancer, he runs a research laboratory focused on identifying and testing new treatments for brain tumors. Theo was born in Athens, Greece, to Greek Arab parents and was raised between Greece and Singapore. He came to the United States for his education in 1993 and has lived in San Francisco for the last 12 years. Theo, welcome. Thank you for joining us this evening.
Thank you for having me.
So tell us about your childhood and growing up in the Arab and Greek cultures.
Yeah, it was very unique experience, I think. I was very fortunate. So my parents are both Greeks that grew up in the Middle East. My father is a seventh generation Palestinian of Greek descent. And actually his father used to be the consular representative for the old city of Jerusalem.
Oh, wow.
For the Greek government, and the actual consulate was in the new part of Jerusalem. And my mother was a Jordanian Greek. And so growing up, there was a big Greek influence in my house, as well as Palestinian and Jordanian Arab influence.
Wow. So tell us more about your childhood. Did you learn the Arabic language or be exposed to the food and the culture?
Yeah, so I was born in Greece. My dad was there for work, and then, of course, there was a lot more Greek influence at that time. And then he actually moved to Singapore ended up being there for 20 years. So there was additional influence there. But certainly at home, there was a lot of Arabic food and language spoken. There was a much bigger Arab community in Singapore than there was a Greek community.
Oh, wow.
And so there used to be at least once a month a big get-together amongst all the Arabs there. And so I grew up eating all the good food, dancing, watching all the movies, listening to all the music. So it was a great experience. Unfortunately, they ended up teaching me Greek at home instead of Arabic. So while I know a few words, it's not as much as I would like.
Oh, wow. Okay. So you had mentioned that you had traveled to Jerusalem.
Yeah.
So tell me more about that trip and what did you see and learn about the Arab culture?
Yeah, it was an incredible experience. So I have lots of relatives live in Jordan, and I've been there several times for weddings and just for a visit. And one day my dad decided to take us to Jerusalem, and so we drove there. It was an incredible journey, and I have two older sisters, and he's taken each of us there separately.
You drove there from Greece?
Sorry, from Jordan.
From Jordan, okay.
Yeah, from Jordan. And so we went to Jerusalem and stayed at the Notre Dame Hotel just outside the Old City of Jerusalem. And we'd go into the Old City of Jerusalem, and one of my cousins, my dad's cousins was there, actually my mother's cousins was there, saw them. But then also we'd walk down these small streets. My dad would knock on the door, and there'd be this 80-year-old woman that says, "Who's that?" And then notice it was my dad, and be so excited to see him and invite us up. And everybody was very friendly and welcoming, and it was just a great way to see the Old City of Jerusalem. I thought it was just incredible to be there. We're surrounded by so much history. See where my father grew up, and of course the food was amazing, and just seeing all these different cultures coexist within those walls was pretty special.
And you grew up in a multicultural environment and then got to travel to Singapore. Right. So what is that like for you to be exposed to so many cultures in your childhood? Well,
yeah, I mean, it's kind of a unique experience. I think I feel it makes me very worldly and easy to connect with people. And I appreciate a lot of different sides to each argument. And so I think in my work with patients, I think it's easy for me to get along with different people from different walks of life because of that. But at the same time, if you ask me what's my home, it's really hard to tell. I've lived lots of different places, and I've had a lot of different positive influences from all these different cultures.
Amazing, absolutely amazing. So let's talk more about your upbringing, and now you're in medicine. So what aspects of your upbringing motivated you to go into the field of medicine?
Right, so yeah, my mother's father, so my grandfather, was a pharmacist in Jerusalem in Jordan, and over there, the local pharmacist is kind of like the town doctor. They can prescribe antibiotics for you and do minor medical things for you. So I learned from him the value of that kind of work, and he was always influencing me, saying, "Oh, you should go become a doctor." And so from an early age, that's what I wanted to pursue, and worked hard at it and got there.
Wow, that's amazing. Did you ever actually get to see him work with patients or help him?
No, unfortunately not. He is a little older, quite older, but I certainly saw him visit other pharmacists and talk with them, and I could see how much they respected him. And I felt that was a good attribute to be respected and be involved in your community.
And you had mentioned, I think before, when we've spoken, that your father was an engineer. Is
Right.
that correct? So how did that also influence you into going into a large career or having a lot of education?
Right, yeah. So my father was a mechanical engineer, got his master's. So he was good in science and math, and those are things I liked, as well as science. I mean, biology. And so I think he certainly encouraged me, as did my mother and the rest of my family. But I think early on I liked science and I liked medicine, so I think I focused on those paths.
Okay, and so where did you end up doing your residency?
Right, so I did my medical school and residency at NYU in
Okay.
New York, and that was a great experience. It was they had both the private hospital there and as well as a public hospital there, and so you got a lot of exposure to different things. So it was a great experience.
And so what was it like being in New York after traveling all over the world, being in Europe and in
Right.
Singapore? So New York itself is a very worldly place. So what was that like for you?
Yeah, New York is a fantastic place. I mean, Singapore is not such a big Greek community or Arabic community, but New York obviously has a lot of everything, and so it was a great experience. A lot of good Greek food there, good Greek restaurants and churches, as well as incredible Arabic food as well. So it was a great experience. I felt very much at home in a place like that, multicultural place.
Definitely.
Yeah.
So let's talk more about medicine. So why specifically pediatrics for you? What motivated you to work in pediatrics?
Yeah, well, I mean, I think growing up, whenever we were in family get-togethers, I was always sitting at the kids' table until they kicked me out when I was about 25. So that's certainly one thing. But on top of that, when I started my medical school, we got exposed to a variety of different types of medicine, and I realized early on, quite a lot of adult medicine, such as adult cardiology or something like that, is working with adults at the end of life, which really, there's not much hope of getting them cured and young again, and so I just didn't feel like that was that called to me necessarily. Whereas a child, if they get some fatal illness, we try to be as aggressive as possible, and then if you fix that, now they got their whole life ahead of them. So that just seemed more of a challenge to me and more something I was more passionate about.
And so for the age group you address for pediatrics, it's ages from what to what specifically?
Yeah, unfortunately, even though it's sad to think about, there's sometimes babies that are born with cancer.
Right.
So we actually have children that are just newborns. Thankfully, that's pretty rare. But then we also see patients up to about 25 or so, because sometimes really the types of cancers that children get are different than the types that adults get. And so if a 24-year-old gets one of those types of cancer, it's better for us to take care of them than our adult colleagues.
Okay, and so what motivated you to work with kids that have cancer in particular?
Yeah, well, I was a biology major in college, and a lot of what we know about modern biology, molecular biology, is learned from children that get cancer, really, because it's a very simple genetic system. So we've learned a lot about that through that pathway. And so I was always learning about cancer, and to me that was kind of the holy grail of biology, is what makes a cancer cell develop from in the field, in the background of normal cells. And so that was very interesting to me. And then I just put that together with pediatrics and decided on pediatric cancer.
And is there a specific type of cancer that you work with children, or is it all kinds?
Yeah, so I take care of kids with all types of cancer when I'm covering the hospital, as well as blood disorders like hemophilia or anemia. But then I mostly specialize in brain tumors, and I also run a research lab that focuses on trying to find new treatments for brain tumors and test those out in animal models as well as in patients.
And I wanted to ask you about your lab research. So what is it that your group does? What is your lab research on in particular?
Yeah, so we're essentially, we've learned a lot about cancer in the past 10, 15 years or so, about genetically what makes it different from other cells. And so in the past, when we treated cancer, it was using very big weapons like radiation or chemotherapy that makes you lose your hair and all that stuff. But so now, since we've learned so much about the biology, we're really trying to use more targeted treatments that interact with those abnormal proteins within the cells. And so we try to find those in brain tumors, mostly pediatric, but also adult, and then work with different collaborators to come up with ways to target those, usually drugs or some kind of small molecule, and then test those in our models. And then if that's effective, test it in patients.
So is there a lot that you learn when you're with patients and you're practicing medicine and you bring that into the lab and vice versa? I mean, do they work well together?
Absolutely. I mean, I think the advantage of being at a place like UCSF is it's on the cutting edge. We have a lot of research trials that allow us to offer the patients as much cutting edge therapy as possible. And then certainly in the lab, if we decide that, oh, this type of patient should respond to this treatment, and we are able to give that treatment, and a few patients respond, but then a couple do not, then we'll try to look back at their biology to see what's different about those patients. Or, for instance, a patient that responds exceptionally well. Mm-hmm. So we learn from those responses, because that's really the most important experiment. Nobody cares the experiment I do on the mice or on the cells. We really want to cure the patients. So absolutely, we learn a lot from those patients.
Do you have a success story in your lab that you could share?
Yeah, so essentially our group found about maybe 5 years ago or so that a particular type of mutation in a gene called BRAF, which is found very frequently in a type of skin cancer called melanoma, and there's a lot of drugs now that target it very effectively. We found a subgroup of pediatric brain tumors also had that mutation. And so in my lab, we showed in some models that if we use that drug in those types of tumors that have that specific type of mutation, they respond very nicely. As opposed to some types of tumors that don't have that mutation, we actually accelerate their growth. So it's very selective. And so now, as a result of that work, after a lot of paperwork, I have a clinical trial nationwide testing that in children, and so far we've had some very nice responses. So that's been very encouraging and exciting.
That's wonderful. Do you have residents that come into your lab and also research with you, or at least try to learn or understand what your work is?
Yeah. So we have people that come from all walks of life, really. We have college students that come in the summers that want to gain some experience. We have medical students that work with us throughout the year. It's hard for the residents to do that because they're really focused on their clinical experience, but we have a lot of graduate students that come in as well. So it's a lot, just like medicine, science is a very, it's like an academic pursuit where you get trained and then it's your job to train somebody else. So UCSF's an academic hospital that's very interested in doing that, and so I certainly like participating in that as well.
So how is it for you to mentor and give back to the next generation of researchers or practitioners that come in and want to learn specifically about your area?
Yeah, I mean, I enjoy doing it. It's it's an opportunity to sharpen your skills as well, because it's one thing if you learn how to do something, but if you're able to teach it, it actually makes you think about it in a different way. And each time you teach something to somebody, you have to come at it from a different angle, because not everybody learns the same way. So I think it helps you makes you know something even better.
Yeah, absolutely. So I wanted to go back about the pediatric aspects. So, I'm sure you have patients who are young children who can't really communicate what they're feeling in terms of symptoms. So I'd imagine, a child 3 and under. So how do you elicit what the symptoms are? I mean, I'm sure some of it's with parents, but what do you do with the children specifically that can't communicate what they're feeling?
Yeah, right. Absolutely what you said. Of course, a lot of it is asking the parents what's going on that's different. But ultimately, you're right, a 3-year-old or a 2-year-old really, it's kind of like you're a veterinary doctor at some points, because really you're not expecting to get a lot of feedback from the patient. And unfortunately, a lot of the time, they're ticklish or they're squeamish, they're scared of you. So you really have to use a lot of tricks. You have to use like some kind of a doll or a flashlight or something to distract them if you're trying to see how their eyes are moving. If you're trying to feel their belly, for instance, they're oftentimes screaming, but you just got to calm them down and have a lot of different distraction techniques. So that's certainly one of the things that you learn during pediatric residency is how to get that job done, because otherwise you'll be there forever trying to see one patient.
Right. So do you have tricks to help build trust with such young children? I mean, is there anything specific that has worked for you in the past?
Well, I mean, I think I've learned from other people that there's this thing called white coat syndrome. If you watch movies, everybody's wearing the doctors are wearing white coats, but especially kids will also watch those movies, and they know that that's associated with a needle, a shot or something like that. So if you walk in to see a patient with a white coat, they're going to get scared. So I never wear a white coat.
Oh, okay.
And most of my colleagues don't either. That's number one. And then everybody on their stethoscope has some kind of doll or something. I got Darth Vader on my stethoscope. But something like that that's going to distract the patients and get them interested in what you're doing. So yeah, we all learn those skills.
So another question I have for you with regards to the cancer aspect, you read a lot about, the medical treatments, whether it's chemo or radiation, is not the right approach. And you'll have a lot of famous people, celebrities, who will advocate things like, alternative lifestyle, organic eating, or, acupuncture. I mean, there are different ways of calming the system. So what's your take on that as a physician, as a doctor?
Yeah, I mean, I think, so there's conspiracy theorists that are out there saying that, oncologists or doctors are trying to just sell their drugs and get rich off this. That's not what's happening. These are patients that are going about their life, and this terrible bad event happens mostly through bad luck, and we're using what we have to treat it. And yeah, most of the drugs we have right now, they're poison. They're essentially
Right.
poisons. If we were to give large enough doses of it, it would kill the patient. So it's my job to use as little of these poisons to fix these patients. We're totally happy to use these other therapies. We're starting to use massage therapy and acupressure in our hospital. The problem is insurance companies often don't pay for those things.
Right.
So that's a big problem. And then number two, a lot of people say like, oh, why don't we use this, some kind of herbal supplement or something like that. Nobody's done a clinical trial where they've taken 100 patients and given them chemotherapy or an herbal supplement and seen what's happened.
Right.
So if that data existed and the herbal supplement showed that it was better, we'd be happy to use it. But those trials haven't been done. It's just anecdotal data saying, oh, I took this herbal supplement and I did well. So, we're very scientific. If somebody has something that they think is going to work, we'll test it in the lab or whatnot. And I actually have been testing a few herbal supplements that some foundation wanted us to test in a model, and so we'll see if that's effective. We'll bring it into patients, but as long as there's science behind it, we're happy to use it.
I think it's wonderful that, even in medicine, that they're even open to those
Right.
type of approaches. I think that's
Yeah.
great. I wanted to touch back again in growing up in Singapore and what that was like. So if you could share, is Singapore kind of a eclectic place, the way one would think of perhaps, Hong Kong, New York City, places that have a lot of cultures. What was it like being Greek and Arab in Singapore?
Yeah, it was fantastic. Singapore is one of the, it's the second largest port in the world. It's a huge multicultural place, big business hub, and the people were very open-minded there. They were, interested in succeeding and in whatever field they were in, but they were very open-minded, and they were took every point of view equally. And so I felt, I could speak freely there about being Greek and talking about issues with the Turks or with Cyprus or whatever, and then equally with the Arab, issues, the problems that were going on in those days in the 90s or 80s. Much of those problems are still continuing, obviously, but there were, people able to have these conversations on both sides, and people realized there was different viewpoints, and people have a conversation. I think as I came to the U.S., one of the things I did realize is that a few people are a little bit more firm in their beliefs and really take those positions very strongly. And so I learned, through some experiments in college, that I probably should avoid some of these more contentious issues.
Yeah, absolutely.
Yeah.
And so what do you do today to stay in touch with the Arab roots that you have? I mean, I know the Greek aspect is still a big part of you, but what do you do for the Arab side?
Yeah, so my parents now, they live in Indianapolis, and they've got a lot of friends there. Most of them are Arabs, and so whenever we go there, we always frequently have dinner parties at their house or at our house, and so there's a lot of Arabic food going around for sure. Over here, if I'm going to go take food home or go out for dinner somewhere, I often choose an Arabic restaurant, and
Right.
so I certainly am very much in touch with that. And I try to read about what's going on in that region and stay up to date with that, and try to stay abreast of that.
Yeah, and when you were in Singapore, were there other students like you who either were Middle Eastern or
Right.
did you have any of that?
Yeah, there was a few Middle Eastern families, a few Greek families that I also stayed in touch with over time. I've got my cousins that live all over the world, really, but quite a few still in Jordan. So I try to visit them whenever I can as well.
And what are your plans for travel? Again, are you planning to ever go back to Jerusalem or want to visit?
Yeah,
other-
absolutely. Actually, my father, that's what his wish. He's 85 now, and he wants to go back to Jerusalem with us or by himself or at some point next year or so. So I think that would be something nice to plan because it's certainly changed a lot. And it's something I'd like to do again for sure.
Absolutely.
Now that I'm a little bit older, I can appreciate it a little bit more.
Yes, for sure, of course. Another question that I have for you was, what advice would you give to parents who have high school age kids that are interested in going into medicine?
Yeah, I mean, I think obviously they have to do well in high school and they have to get into a good college, they get into good med school, but I think more and more people want you to get exposure to that field before you decide that's the career you want to. So I think, we're very open to having high school students volunteer with us over the summers in the laboratory just to see what's going on, and then they can come to some of these clinical meetings to see how we take care of some of these patients. So we're always welcome at UCSF for people to do that, and I encourage people to apply.
So you have had high school interns in the past, so what kind of work do they do?
Well, so they learn how to take care of cells and cancer cells growing in petri dishes. They can participate in some small experiment depending on how long they're going to be there. I think if they're going to be there for 3-4 weeks, they can't really do much of their own. But if they're going to commit to 3 months or 2 months, then we can often train them and have them do a small project that, sometimes will be of use to everybody, and they'll come back the next summer and continue working on it. So,
could you highlight a little bit more about your residency experience?
My residency in New York.
Yes.
Yeah, I mean, it was an intense time. You are in the hospital for 18 hours a day for 6 days a week. So it's.
I've heard it can be a sleepless.
Right. Yeah, it's pretty tough. But also, I think that's important because, when you make a medical decision, you want to see what the consequences of that decision are. And sometimes the consequence doesn't happen within 3 hours. It happens 8 hours or 12 hours later. Whereas now there's a lot of new laws to try to limit how the residents' work hours are. And as a result, they're only there for 12 hours maximum. And now you don't get to see the consequences of your actions. And so there's a big question whether or not we're training people as well as we were 20, 30 years ago.
So in residency, are you exposed to many different types of practice? I mean, or are you specific at that point for you, for example, specifically on pediatrics?
Yeah, so your residency, med school is where you get your exposure to all sorts of different types of fields, and then residency, you've chosen one. So for me, it was pediatrics, but it would be emergency room, neonatal ICU emergency room, lots of different aspects of pediatrics. And then at that point, if you want to further specialize, that's when you apply for your fellowship, which is what I did to do pediatric oncology at UCSF.
And do you have any particularly favorite Arabic dishes that you think about these days?
Well, I like knafe, the dessert. That's one of my favorites.
Good. Yes.
My dad makes a good knafe, so I'm looking forward to that over Christmas this year.
Good. Very good. Can you tell me a little bit more in Singapore, that aspect of being confident in sharing where your family was from and what life was like in Singapore in terms of being open about being Arab?
Yeah, I mean, I think, like I said, I think people there, well, there's a lot of British influence there, and so people had a lot of understanding of what's going on in that region from lots of different parts. So I think there was more of a conversation going on that was open, and nobody was really blaming one side or the other. And now I think other parts I've lived, I tend to be a little bit more cautious about having those kind of discussions because people here get very politicized about that.
And finally, as we wrap up,
Yeah.
Do you have any advice that you would give to families in terms of healthy living, healthy lifestyle? I'm sure many often are, everyone worries about cancer on some level. So do you have any advice that you could offer?
Yeah, I mean, I think getting exercise is important. Eating a well-balanced diet is important. In terms of children's cancer, it's just mostly bad luck. So really, as far as we know, not much to prevent it. But as you get older, these other types of cancer, lung cancer, liver cancer, skin cancer, that's definitely related to smoking, excessive alcohol use, excessive sun exposure. So all of those things should be, avoided or minimized. Certainly sun, you should cover up when you're younger because that takes 10, 20 years to develop. So.
Absolutely.
Yeah.
Absolutely. Well, that's all the time that we have. I want to thank you so much for coming and spending the time with us and telling us about your background and your background in medicine as well as how you grew up. And this is Leyna Cotran. Thank you very much to Dr. Theo Nicolaides for joining us. This is Arab TV. Good night.
Thank you.